One of the most fascinating topics in your book, The End of Alzheimer's, is just the whole concept of epigenetics, and specifically how we can, with nutrition and lifestyle intervention, mitigate genetic risk, even if we're carrying 1 or 2 copies of ApoE4. And I think that is providing a lot of hope to a lot of people out there. What are your thoughts on that?
Yeah, so the good news is genetics are rarely your destiny.
Yeah.
And so you have a lot to say about how they're going to be, how your genes are going to be read out, basically.
A blueprint, I've heard you say.
Exactly. So you're able to change how this blueprint is read. And so therefore, you really actually have a lot of power. What we were taught and what I was taught when I was in medical school and also in neurology residency was that there is nothing that can be done. The armamentarium is a couple of drugs that don't work very well. The reality is that the armamentarium for cognitive decline is huge. It's gigantic because it includes the way you'll handle insulin, your resistance, whether you're going to signal appropriately. It includes things like whether you are in ketosis or not. It includes things like whether you have detoxed appropriately, whether you are exposed to a whole flight of toxins. And of course, we're exposed to toxins like never before in history.
Yeah.
Whether you have specific occult infections. It's really interesting to me that it used to be that we really worried about leprosy. We really worried about polio. We really worried about syphilis. I mean, these were all in their day scourges. And Alzheimer's is no different. We will look back on this and say, wow, people used to really worry about this just like they used to worry about leprosy.
Yeah.
It will be a rare disease, certainly by the end of this century, but my hope is long before that. This will be a very rare disease.